Let me ask you a personal question, one that most doctors never bring up, and one that most men never talk about, especially after 60. When was the last time you thought about how your solo habits might be affecting your health? Now, before you raise an eyebrow or click away, let me assure you this is a completely normal, even important part of many men's lives, no matter the age. But here's the problem. What if I told you that some of the ways older men handle this private area of their health could actually be doing more harm than good? That certain small mistakes, often done out of habit or just not knowing any better, might be quietly hurting your prostate, affecting your bladder, disturbing your sleep, or even interfering with your ability to enjoy intimacy with a partner. I've seen it more times than I can count over my 30-plus years as a urologist and senior health expert. The truth is, most men don't know what's normal after 60, and they certainly don't know what's risky. But that ends today. In this video, I'm going to share 4 common mistakes men over 60 often make when it comes to masturbation and how to avoid them so you can stay healthy, feel good, and protect your confidence. And hey, if this kind of open, honest health advice is helpful to you, go ahead and click that subscribe button. I promise you, we talk about the things that really matter here. All right, let's dive in. Now, before we jump into the 4 mistakes, let me quickly introduce myself, especially if you're new here. I'm Dr. John, and for over 30 years, I've been helping older men and women across the country take control of their health, feel better in their bodies, and live with more energy, dignity, and peace of mind. I specialize in urology and senior health, and one thing I've learned over the decades is this. The topics we're most uncomfortable talking about are often the ones that impact us the most. See, most men are never taught what to expect from their bodies as they age, especially when it comes to changes in sexual function. And if you're like many of my patients, you might be thinking, is this normal? Should I be worried, or even why hasn't anyone talked to me about this before? That's exactly why I made this video. Because the truth is, masturbation in your 60s, 70s, even 80s can absolutely be a normal, healthy part of life, but only if it's done in a way that respects your body's changing needs. This is not about judgment. This is not about shame. This is about protecting your prostate, your nerve health, your emotional well-being, and your ability to feel connected, calm, and confident. So, in just a moment, we're going to talk about the first common mistake, something that seems harmless, but could be a quiet warning sign your body is trying to give you. Stick with me because I promise this is something every man over 60 should know. Let's start with one of the most overlooked and potentially serious mistakes I see among older men: ignoring changes in sensation or pain. Now, I get it. You might think it's just a little discomfort, or maybe I'm just getting older. And while it's true that the body naturally changes with age, pain or a noticeable change in sensation, especially in the pelvic area, is not something you should ignore. Let me tell you about one of my patients, Robert, a 67-year-old retired teacher. He came in for a routine checkup, and toward the end of our visit, he hesitated, then quietly mentioned that he'd been feeling a dull ache after masturbation. "It's not terrible," he said, "just annoying." I figured it was nothing. But here's the thing. When I examined him and ran a few tests, we found he had early signs of chronic prostatitis. That's an inflammation of the prostate gland that can lead to pain, urinary problems, and in some cases long-term damage if left untreated. Robert was lucky. Because he brought it up early, we were able to treat it with a simple combination of medication, pelvic floor exercises, and a few changes to his routine. He's feeling great now. But what if he hadn't said anything? See, in many cases, discomfort or pain during or after masturbation in older men can point to issues like prostatitis, enlarged prostate BPH, pelvic floor tension, even nerve sensitivity or damage. And here's the tricky part. Sometimes the pain isn't sharp. It can be dull, vague, or feel like it's coming from the inside. That makes it easy to brush off, especially if you're not experiencing it every time. But here's what I tell every patient. Your body is talking to you. The question is, are you listening? So, how do you know what's normal and what's not? Here are 3 simple things to look out for. Pain or discomfort during or right after orgasm, especially if it's in the lower abdomen, pelvic region, or testicles. Changes in sensitivity, such as a sudden drop in sensation or a numb feeling that wasn't there before. New urinary symptoms, like needing to pee more often weak stream, or feeling like you didn't empty fully after urinating. If you notice any of these, don't panic, but don't ignore them either. A quick visit to your urologist can help rule out serious issues and often leads to simple, effective treatments. One tip I give my patients: keep a short health journal. If you feel any discomfort, jot down when it happened, what it felt like, and how long it lasted. Over a week or two, you'll start to see patterns, and that information can be incredibly helpful to your doctor. Remember, at this stage in life, it's not about being tough and pushing through. It's about being wise, attentive, and proactive. And speaking of habits, we often overlook. What if I told you that the way many older men touch themselves might be doing silent damage to their sensitivity and intimacy? Let's talk about mistake number 2 next, and trust me, this one will surprise you. Now let's move on to mistake number 2, and this one is incredibly common but rarely talked about. Using too much pressure or aggressive techniques. Now I know this might sound a bit awkward to hear from a doctor, but it's important. And here's why: as men age, there are natural changes in nerve sensitivity, blood flow, and skin elasticity. So the way you might have handled things in your 30s or 40s, it may not be right for your body in your 60s or beyond. I want to share something a patient once told me that really stuck with me. He said, "Dr. John, I don't know what's wrong. I feel like I need to grip tighter and go faster just to feel anything." This man was in his early 70s. He was healthy overall, but he'd been using very intense high-pressure techniques for years. The result, he developed what we call in the medical world death grip syndrome. That's not an official diagnosis, of course, but it's a phrase used to describe what happens when frequent high-pressure stimulation conditions your brain and body to respond only to that very specific kind of touch. Over time, it can desensitize the nerve endings in the penis, and that makes arousal with a partner or even regular sensation much harder to experience. Imagine trying to tune a delicate guitar string. If you pull it too tight, it doesn't sing, it snaps. The body works the same way. Gentleness, flexibility, and mindfulness matter. Aggressive techniques can also lead to microtears in the skin, irritation, and in some cases, nerve damage. That might show up as a tingling sensation, reduced pleasure, or even mild pain. And it's not just about sensitivity. That extra pressure can affect blood flow, making it harder to maintain an erection over time. It's like overinflating a tire. Every day it wears out faster. So, what can you do instead? Here are a few tips I share with my patients that make a big difference. Ease up on the grip. Try using an open hand or just your fingertips instead of a tight fist. This helps retrain your nerves to respond to lighter, more natural sensations. Use proper lubrication. As we age, skin becomes more sensitive and prone to friction-related irritation. A good skin-safe lubricant can help protect the tissue and make the experience smoother. Focus on arousal, not just release. Take your time. Shift your attention to breathing, muscle relaxation, or even imagining an emotional connection. This trains your body to enjoy the whole experience, not just the endpoint. Give your body variety. Avoid doing things the same exact way every time. Variety keeps your nervous system tuned, just like changing up your workouts keeps your muscles healthy. These small changes can protect your long-term sensitivity, improve your intimacy with a partner, and reduce the risk of irritation or injury. And here's something you may not have considered: the more intensely you stimulate your body, the more often you might feel the urge to repeat it, which brings us to the next mistake. What if how often you're doing this is quietly affecting your energy hormones or even your sleep? Let's explore that next. Mistake number 3 is a big one. All right, let's talk about mistake number 3, and this one might surprise you because it doesn't get discussed in your average doctor's office. Overdoing frequency, or using masturbation as an emotional escape. Now, let me be crystal clear here. There is nothing wrong with masturbation itself. For many older men, it's a healthy, normal part of life. It can help relieve stress, improve circulation, and even help you sleep when done mindfully. But here's where things can go off track. If you find yourself doing it out of boredom, loneliness, or just as a habit to pass the time rather than real desire, it can start to take a toll, not just physically, but emotionally and hormonally as well. Let me tell you about Alan, a 72-year-old widower who came to me complaining of low energy, poor sleep, and just a general blah feeling he couldn't shake. His blood work looked okay. He was eating reasonably well, walking every day, but something wasn't adding up. As we talked more openly, he admitted that he had gotten into a pattern. He was masturbating almost every night, not because he felt particularly aroused, but because it had become a kind of default activity before bed. He said, "It's just something I do when I feel lonely or restless, like a way to end the day." Now again, there's no shame in that. Life gets quiet, especially if you're living alone. But over time, Alan's pattern was leaving him drained. And here's why. Every time you ejaculate, your body goes through a release of several hormones, dopamine, oxytocin, and prolactin, among others. These are great in moderation, but when ejaculation happens too frequently in older men, it can sometimes contribute to fatigue, lower motivation, and even mild testosterone suppression over time. Think of it like spending from your energy bank account, a withdrawal here and there. Totally fine, but too many withdrawals in a short time without enough deposits of rest, nutrition, and connection, and you start running a deficit. And here's something else to consider. If masturbation becomes your main emotional coping tool, it can mask deeper needs, like the need for companionship, stimulation, or even grief that hasn't been processed. That's why I often encourage my patients to ask themselves this simple question before they engage in the habit. Am I doing this out of desire or out of distraction? This little pause can be incredibly powerful. So, what's a healthy frequency? That really depends on the individual. But for most men in their 60s and 70s, somewhere between 1 to 3 times per week is generally a balanced, healthy rhythm. Of course, that varies. Some men feel great with less, some prefer more. The key is to listen to your body and watch your energy levels afterward. Here's a quick tip I've shared in my clinic that many men find helpful: the energy test. Afterward, do you feel recharged and calm, or do you feel tired, empty, or mentally foggy? Your body will tell you if you're overdoing it. Also, try giving yourself at least 2 or 3 off days each week to let your body rest. You might be surprised by how much more balanced and energized you feel. Now, let's be real for a moment. Sometimes the habit isn't just physical or emotional. Sometimes it's about secrecy. And that brings us to the 4th mistake, one that can quietly sabotage confidence, relationships, and even self-worth if we don't talk about it. Let's talk about mistake number 4. And this one goes beyond the physical. It gets to the heart of emotional health, self-esteem, and even connection with others. Hiding the habit or carrying shame around it. Now, this is something I've seen again and again in my practice, especially among older men. It might show up as brushing the topic off with a joke, avoiding eye contact when I ask questions about intimacy, or hesitating before bringing up concerns, sometimes not mentioning them at all unless I ask directly. And I get it. Most men over 60 grew up in a time when this topic was rarely, if ever, spoken about openly. Maybe you were taught it was shameful. Maybe religion, family, or culture told you it was wrong or something to feel guilty about. But here's the truth. There is nothing wrong with masturbation. It's not dirty. It's not a sin. It's not a sign of weakness. It's simply one way that many men and women care for themselves, especially as they age, and physical intimacy with a partner may become less frequent or more complicated. But when it becomes a secret, when it's hidden out of fear, guilt, or embarrassment, it can start to chip away at how you feel about yourself. You might start to feel isolated, or like there's something off about your needs or desires. I had a patient, once a man in his mid-60s named George, who had been married for over 40 years. His wife had gone through a difficult illness, and their physical intimacy had gradually faded away. He told me in a very quiet voice that he still masturbated once in a while, but he felt guilty about it, like he was betraying her. But when we talked more, what came out was something deeper. He missed connection. He missed feeling desired, and he didn't know how to talk about that, so he kept it all bottled up. And that's what I want to encourage you to break free from, because carrying shame around this part of your life doesn't just hurt your emotional well-being. It can lead to anxiety, low mood, and in some cases, secrecy that damages relationships. So, what's the solution? Here's my advice. Acknowledge your humanity. You are not broken. You are not bad. You are a human being with natural desires that don't disappear with age. In fact, the need for touch, closeness, and emotional release is often stronger as we grow older, not weaker. Talk to someone you trust. If you have a partner, gently open the door to conversation. You might be surprised how open and understanding they are. If you're single, consider sharing your thoughts with a doctor, counselor, or close friend. Vulnerability is not weakness, it's strength. Watch yourself talk. Notice how you speak to yourself before and after you engage in any intimate habit. If there's guilt, ask yourself, is this coming from something real or from an old belief I've outgrown? Replace secrecy with self-care. Make your experience something you feel good about. Set the tone dim, the lights put on music, breathe slowly. It's not about rushing through something in shame, it's about honoring your body and your needs. The more openly and kindly you approach this part of your life, the more confidence, peace, and even vitality you'll begin to feel. And here's the beautiful part, when you stop hiding, you start healing. And that makes room for better conversations, deeper intimacy, whether with a partner or simply with yourself, and a far more joyful life. So let's quickly recap where we've been. Mistake number 1, ignoring changes in pain or sensation. Mistake number 2, using too much pressure or aggressive techniques. Mistake number 3, overdoing frequency or using it for emotional escape. Mistake number 4, hiding the habit or feeling shame around it. Now, I'd love to know which of these stood out to you the most. Have you noticed any of these in your own life? Drop me a comment below and share your thoughts. Or just leave if something here helped you today. And if you found this video valuable, go ahead and subscribe so you don't miss future episodes. I make these videos for you for the quiet questions no one else is answering, and I'm not going anywhere. But we're not quite done yet because I want to leave you with one simple takeaway that could change how you see this part of your life going forward. So here's the takeaway I want you to carry with you. Your sexuality doesn't expire with age. It changes, but it's still a vital, worthy, and natural part of who you are. And taking the time to understand your body, care for it gently, and approach your needs without shame, that's not just good for your health. It's good for your heart, your spirit, your peace of mind. If this video helped you even in a small way, drop a 1 in the comments and share this with a friend who might need to hear it. You never know who's quietly struggling with the same questions. And remember, you're never too old to learn something new, care for yourself differently, or start feeling better inside and out. I'm Dr. John, and I'll see you in the next one. Until then, stay curious, stay kind to yourself, and take care.